How long would you wait to intervene with someone you love struggling with an illness? What if it's an illness you're not sure you can fully see? As someone who's survived an eating disorder, I'm here to tell you they can be both very dangerous and very easy to hide. So, the information I want to impart on you today is how one can be at higher risk of falling into an eating disorder, the health risks that go along with eating disorders, how to spot an eating disorder, and most importantly, how to help someone you care about recover from an eating disorder. First thing to know about eating disorders is what can lead to someone being at higher risk of falling into one. Did you know that, according to the National Alliance on Mental Illness, people in your family having eating disorders increases your risk of falling prey to an eating disorder? Having other mental illnesses can also increase your chance of developing an eating disorder, especially when you're already having a hard time handling those other mental illnesses. Dieting actually can also increase your risk of an eating disorder because if you diet incorrectly, it can drive your body into starvation mode, in which your brain can be affected into forcefully reducing your appetite to conserve the resources it still has left. The last thing I want to touch on that can increase your risk of developing an eating disorder is stress. Any change in your life can do a really big number on your psyche and push you in a bad direction, especially if your brain perceives that big change as bad or wrong. The second thing to know about eating disorders is the additional health risks that go along with them. Lots of people know about the scary weight loss and risk to your life in general that eating disorders can cause. But did you know that according to the National Alliance for Eating Disorders, we actually lose nearly one person every 52 minutes as a direct result of their eating disorder? On the non fatal end of things, different types of eating disorders can do different types of damage to your body. From personal experience, I can tell you that bulimia can lead to you seriously damaging your teeth. There's different methods of purging as far as bulimia goes, of course, but a very common one, and one that I used myself, is making yourself vomit. What a lot of people don't know, though, is that all that acid from vomiting eats away at your teeth and can and will do long-term damage to them. Anorexia, on the other hand, can lead to hair loss due to nutritional deficiencies from being malnourished. Both of these disorders I've just mentioned can also lead to frequent dehydration, which can cause you to become confused, can cause you to faint, be slow to respond to people, and, worst case scenario, can also lead to death. The third thing to know about eating disorders is how to spot one. There are, of course, more ways to spot an eating disorder than what I'm going to cover here, but I did want to touch on a couple of them that I've experienced myself, as well as one that I found in my research. For me, the things that changed when I developed my eating disorder were that I started making up excuses for why I couldn't stay at the table with my family for full meals. I'd leave the table and hide in the bathroom, making myself sick and purging anything I'd eaten during dinner. I also started being secretive about my eating just kind of in general. I'd sneak snacks and meals when people weren't home, but I'd still wind up purging them and getting upset about losing control over myself. And yet, I still told myself it was okay because the only person I was hurting was me. Mind you, when my eating disorder started, I was 11 years old. I didn't have a good sense of my actions affecting other people. But with the passage of time and the start of my recovery, I really started realizing how much damage I was doing not just to myself, but to other people. The third sign of someone having an eating disorder that I want to talk about is them withdrawing from normal social activities that they usually participate in, which is something that happens fairly frequently according to the Mayo Health Clinic. They specifically mention that these kind of situations can make people tend to self-isolate. Finally, and most importantly, I want to talk to you about how to help someone recover from an eating disorder. It's been shown that both talk therapy and behavioral therapy can help people recover from eating disorders. Medicines such as antidepressants and ones that reduce anxiety have also been shown to be effective tools in helping someone recover from an eating disorder. In my research, thanks again to the Mayo Health Clinic, I also found that it's suggested to get your family's support in monitoring the restoration of a normal weight for your body type, as well as getting help with finding a professional nutritional counselor. But as someone that survived this, what I can tell you helped me the most was having patient people around me that supported me and didn't guilt trip me or make me feel bad if I had a relapse. Eating disorders aren't easy to recover from, no mental illness is, but feeling loved and supported can really make a difference. It did for me. In summation, I understand better than anyone that this is a very uncomfortable topic to talk about. It's deeply personal, and the person that you want to help may not always be able or willing to listen to that help. With everything I've talked about, let me go over all my points again. Like how one can be at higher risk of falling into an eating disorder, the health risks that go along with eating disorders, how to spot an eating disorder, and of course, most importantly, how to help someone you care about recover from their eating disorder. I want to challenge you today to pay better attention to the people you love. And if you suspect someone you know is struggling with an eating disorder, please do everything you can to help them. It may just save their life.